Well, I'm very pleased to be here in Hobart today for this very important event, and I'll ask Susan Lee, as the Minister for the Environment, to speak more to that matter shortly. But can I also welcome, of course, the Premier, or rather I'm pleased to be welcomed by the Premier into Tasmania, and welcome to be welcomed back into Tasmania. But sadly, the events of the last few days, I mean, it's a terribly awful time for Tasmanians, and on behalf of Jenny and I and all Australians, want to extend our deep sympathies to the 5 families in particular who've lost those precious young ones, and we think also of the families of the 3 who are still in a terribly critical condition. We think of the entire community that is just heaving with sorrow. As I said yesterday, there are no words, only prayers for our fellow Australians in Tasmania and for the community that will carry this burden. And it will be a heavy burden. It will weigh them down. But I want to say to them, whether they're the first responders, the teachers, the friends, the family, the PNC at Hillcrest, the whole community, that Australia is one with them. And we grieve with them and we mourn with them, and we want to do everything we possibly can to help them through this terrible, unthinkable, unimaginable tragedy. I want to thank Premier Gutwein for being in close contact with me over the last few days. We were speaking by chance just that morning we'd arranged, and these events overtook those conversations. And we've stayed in touch about trying to understand what we can do as a Commonwealth to help the community in Devonport, and particularly the families and others directly impacted. And so we discussed the need that there will be ongoing counselling and other emotional support, particularly mental health support. And as a result of those discussions, I discussed this with the Health Minister and our other advisors, and we are providing $800,000 to support families and communities affected in counselling support, $250,000 for first responders, $550,000 for the broader community. This will be paid to the Tasmania's primary health network. It'll be provided over an 18-month period, because we know support won't just be needed in the next few weeks. It'll be needed for many months to try and begin that process of healing. There's additional trauma counselling and the $250,000 for those involved, and training for those services in trauma of informed care and psychological first aid and to assist in recovery. The $550,000 includes $200,000 for additional trauma counselling in the community. There's $200,000 for the local headspace, trauma care and training, and expanded supports for young people. There's $100,000 to support return of school in 2022, including training and counselling for teachers and staff, and $50,000 in community mental health and wellbeing grants to support the community. And obviously all the team up there, particularly Gav Pearce, the member for Braddon, who's done a terrific job working with the local community, and to Senator Dunham is here, and the whole Senate team and our whole team at both state and federal level has been reaching out to support the community in Devonport. And so we will reach out our arms and we'll throw them around the community of Devonport, and Australia will throw their arms around Tasmania as they seek to console for what has been an unthinkable time. And so with that, I'll ask the Premier to say a few words. But on the topic of being also here today, it has been a great pleasure to be able to launch the new Nuyina and the great mission that she has embarked on. It's testament to our commitment, to our stewardship of the Antarctic, and our commitment to the Antarctic Treaty, amongst so many other like-minded nations who share a passion for this unique environment. And as Antarctica's one of its closest neighbours, we have a special responsibility, and have always stewarded that responsibility to the utmost of our ability and our commitment. And I thickly want to thank Minister Lee for her strong commitment to this project, and all the work that has been done by our agencies to bring us to this day. And with that, I'll pass over to the Premier. Thanks, Pete.
Well, thank you, Prime Minister, and it's my pleasure to welcome you to Tasmania along with Minister Lee. Look, firstly, if I could just touch on Devonport and thank the Prime Minister for the support that his government is providing. When I spoke with him yesterday and again on the day that this event tragically happened, he immediately offered whatever support was necessary, and obviously in terms of the counselling and working with our community, that work is going to be ongoing for some time. And so I thank him for that. I'd also acknowledge that other premiers around the country have reached out and offered the support from their states as well. This builds on a package that we announced late yesterday. We've put in place the Regional Social Recovery Committee under our State Emergency Management Act to deal with matters like this, and that committee has already met. It has members including the Devonport City Council and others from across our departments. And one of the recommendations from that committee was that the government should immediately make a first stage $500,000 to support counselling and other supports in the community, and we announced that yesterday, and so I'm very pleased that the $800,000 that the Prime Minister has announced this morning will build on that. But could I just say once again to all of those that have been impacted by this terrible, terrible tragedy, to the families of the 5 children who passed away, words can't express the sympathy that I feel, that Tasmanians feel, the outpouring of sympathy right across this country. And I thank people for that, but note that we be with them. Importantly, for the 3 children that remain in hospital, our hopes and prayers remain with them in terms of the challenges that they face. But in respect of the broader community, as I said yesterday, it was inspiring to hear the comments and the thoughts and the offers of support from right across those that live on the northwest coast, those that are engaged with that school, those that are employed in our emergency services and with our first responders. Tasmania will get through this, and we will stand with those families and with that school community as they work through this very challenging time. In terms of this morning and the Nuyina, as I said when I spoke this morning, on the 14th of October, unfortunately, we were in a very short lockdown, one of the very few that we've had in Tasmania, and as this magnificent vessel sailed into this magnificent harbour, I was but one of only a handful of people that watched this arrive with little pomp and ceremony. But this vessel and the investment by the Australian government and over a long period of time as part of a program of nearly $2 billion worth of investment will strengthen the links that we have with Antarctica, but importantly also embed and cement Hobart as the gateway to Antarctica, and I'm very thankful for the investment by the Commonwealth in that regard. I do also just want to touch on the matter of COVID, and this morning we've had another case. It's in the north of the state. The details in respect of that case are on the coronavirus tas.gov.au website. Our contact tracers are working through matters at the moment. I understand that initially there are around 19 close contacts, 16 that were on the flight that arrived on Thursday afternoon, and 3 close family members, and we'll continue to update matters as we receive more information. But my message to Tasmanians is we expected that this would occur. We have planned for this. Our systems are strong. The procedures that we have in place and the investment that we have made readies us for this. But most importantly, we are one of the most vaccinated places on the planet. Yesterday we passed the 90% double vax threshold for those aged 12 and over. In terms of over 16s, we're closing in on 97% in terms of first vaccinations. And so we have a very vaccinated population. We have invested well in terms of our supports and our health system. And importantly, Tasmanians should not be concerned by this. We always knew that COVID would arrive, It's just simply a matter of ensuring that you keep informed and you do the little things. There is no mask mandate in Tasmania, but it is being considered. But importantly, if you can't socially distance, ensure that if you're indoors, that you wear a mask, that you have good hand hygiene, and you do those things that we can each take a little bit of responsibility for to keep our community safe. I'll hand over to Susan Lee.
Thank you very much. Premier and Prime Minister, can I echo your words of sympathy and sorrow for the Devonport community and wish them all the love, help and courage over the months ahead. It's an important occasion today, and one that, as the Premier said, we weren't able to mark earlier given the logistics of COVID. Today we've had a really good recognition and send-off for the RSV Nuyina, our $1.9 billion state-of-the-art icebreaker. There is no more advanced polar research vessel in the world. This is an extraordinary ship, and I've been privileged to have a look over her this morning, and she is indeed remarkable. And she will not only transport expeditioners and resupply our 4 stations in Antarctica, she will also host international collaborations of scientists on laboratories that have to be seen to be believed. There is what's called a moon pool, a 13-metre well that lifts through the ice the waters of the Southern Ocean to examine a range of indicators of the ecosystem. So if you can consider science in the depths of the ocean, ice sheets, and also in the upper atmosphere contributing to climate science internationally, this vessel is a real underscoring of our commitment. And I want to thank the Prime Minister for his leadership in recognising that our Antarctic science program is underpinned by Tasmania. Thank you, Premier. The jobs, the investment, the industries, many of whom I've had an opportunity to meet personally over the last few days, are extraordinary. They've come up with novel ideas, with adaptations. They've gone down there and spent time in the Traverse tractor being pulling the sleds that go 1,100 kilometres inland to build remote mobile stations and drill for the Million-Year Ice Core. This is such a Tasmanian gateway, and a gateway for jobs and growth and the future of this incredible state. But my mission is always for the whole of Australia to understand our government's commitment to Antarctic science and to meet the people. So as Senator John O'Daniam often reminds me, the scientists, the expeditioners themselves, the suppliers, the provisioners, the mechanics, the repairers that make up the Antarctic program are extraordinary. And I want to thank also the AAD, the Australian Antarctic Division, led by Kim Ellis, the wonderful staff, and what they do every day to make Antarctic exploration possible. And with this ship, this incredible ship, to take that exploration, that science, that environmental protection to the next level. Thank you.
Thank you. Happy to take some questions.
Just on the Hillcrest tragedy, we've seen around $1 million raised for the families affected through GoFundMe. Have you been personally touched just by how deep the community has been willing to help out those families?
Well, I have, but I'm also not surprised at the generosity of spirit that flows. I've seen this as Prime Minister every day as we've dealt with some terrible tragedies in this country over the last 3 years, and on each occasion there is just, Australia are big-hearted people. They feel the tragedies that others experience, and their instinct is just to reach out and to console and support and do whatever they can. And we're seeing that again here. And for the families and the community that are going through this, that will sound, I'm sure, hard to connect to because of the level of their grief. But it will mean a lot, I have no doubt. And it will help Hill, it will help the grieving process. And so, on behalf of all Australians, thank you to Australians for reaching out in the way you always do.
Nationally consistent guidelines all inflatable equipment, regardless of whether it's 3 metres tall or not, has to be registered. Is that something you'll look at?
Do you want to just let that recede a little bit? That
Yeah,
was pretty,
sure.
it's pretty
That's all
loud
right.
just on the end.
That's okay. No, I think I got the question though. And look, and Peter might want to comment on this as well, and because actions have already been taken here in
Look, I think
Tasmania.
that's pretty good now.
Actions have been taken here in Tasmania already, and of course there'll be the appropriate inquiries by the authorities here, and that is the best place, I think, for those issues in the first instance to be investigated. But of course the Commonwealth always seeks to harmonise between states and territories, and I think there'll be, of course, lessons learned in this process, and the Commonwealth will work with the other states and territories who have carriage and responsibility for these issues to seek to harmonise and have consistency wherever possible.
You and your wife Jenny will be visiting Devonport later today. What conversations will you be having with the school and the wider community about this tragedy?
Well, we're visiting to privately pay our respects today, and I spoke to the Police Commissioner yesterday, and what we are doing is respecting his advice, which is we need to give the families space and time. It is unimaginable as a parent to think what they're going through. You don't even want to contemplate it in your own head. And so they will need time. They will need stillness, and they'll need quiet, and they'll need those closest to them in their own families to be throwing their arms around them and weeping with them. That is what they need, and we need to respect their space, and we need to respect their privacy and how they wish to grieve. But Jenny and I will go there today. We'll go there as the Prime Minister and as a couple, but also as parents, like any other parents who are coming along and paying their respects.
Minister, there's a study there's no evidence as yet that I'm this severe. On the basis of that, is there a risk that the Australian public is being held to a premature sensitive basis about a possible threat? If you were just going to keep doing analysis and doing rapid investigations.
Well, what I'd say is that we have been waiting for much information to be coming through, and I'm in regular contact with the Chief Medical Officer. Indeed, he just provided me with further advice this morning. I met with him yesterday. We are constantly in contact on these issues, and his advice to me is that there is still a lot to learn about Omicron. And at the last meeting of National Cabinet, we tasked the AHPPC, the expert medical panel, to be looking at all of these issues. And I wouldn't agree that Australians are complacent about it, and I wouldn't agree that any Premier or Chief Minister or me as Prime Minister or any of our health ministers are complacent either. We take this incredibly seriously, but it's best addressed with a calm head and a clear plan, and being able to rely especially on what the Australian people have done with vaccination, and Peter made this point. Tasmania, I can tell you right now, is the lead state on boosters. Just like they were, as Peter will recall, was the lead state on getting vaccinated as well. The other states caught up to them, of course, but they're on the leading edge of states on vaccination, and Peter has run you through the figures. Australia is not the UK, Australia is not Europe, it's not North America. Our experience with COVID has been very different. We have one of the highest vaccination rates in the world, and our booster program is well underway. Over 1.2 million people have already had their booster. On top of that, our economy is coming through strong, and I always said we must save lives and livelihoods. We have to protect lives and livelihoods, and you've got to get that balance right with your settings. And we have one of the lowest death rates from COVID of any country in the world. So that puts us in a strong position to deal with these challenges, but you take the challenges seriously, you listen to the best medical advice, you get the information, you don't jump at shadows, you wait for the best information, and that's another piece of information that has come in, and I'm sure will help to continue to inform all of the decision makers about what the best way forward is. But what I do know is Australia can't go back. We have to go forward. We have to live with this virus. We have to live with it safely. The national plan was about opening safely to remain safely open, and that's what we're doing. It was based on the best medical science in the world through the Doherty Institute. And so the best thing for people to do is, as the Premier said, show common sense with your own personal health care and hygiene. Get vaccinated and listen out for the information and the rules, and Australia will live with this virus, and we are doing it even now.
Targi has decided not to reduce the interval booster shots. Is that a decision you agree with?
Well, of course, they are the medical experts who decide those things. That is their job, to make the medical determinations about what the appropriate period is between a booster shot and the second vaccine. Now, I know that is under constant review. I know that they are looking at different timeframes, but at this point they've decided not to do that. There are well over 2 million, almost 3 million Australians who are eligible right now for the boosters, and so there are plenty of vaccines. And so it's important that they go and get their booster shots now. You can get the Moderna shot, you can get the Pfizer shot. They're all as good as each other. And I encourage you to go and do that, whether it's for a pharmacy or a GP. And I particularly want to thank Premier Gutwein for his commitment to keeping the state-based vaccine hubs rolling out. That's tremendous. And have asked all premiers and chief ministers to be doing the same thing as I just discussed with them at National Cabinet the other day.
Is there any medical advice about when states and territories should potentially consider restrictions of case numbers? We've seen 24. Is there any advice at all about restrictions of case numbers?
Yeah. Living with the virus under the national plan is not about case numbers. And so we need to be careful in how we talk about case numbers. I'm not going to alarm people on case numbers. What matters is hospitalisations, ICU, people on ventilators, and severe illness. And that's what matters. And that's the key indicators and the thresholds for determining what public health settings should be. We're past the time when we would just talk about case numbers. That is not the trigger for other decisions. It is a leading indicator on some issues, but the real issue is how many people are experiencing serious illness. Now, there's just about 24, I think, in New South Wales currently who are in that situation. And as a result, the case numbers are not translating into immediate pressure, but that's not to say it won't. But we're ready for this. And we've been planning for this. We planned to live with the virus. We didn't plan to remain shut in.
For weeks now, the government said that it's working with Indigenous vaccination rates in Tennant Creek. Only in the Tennant Creek area, only around 1 in 3 people are vaccinated. What are you doing to lift that rate? And is it a concern?
Well, working directly with the community and the Northern Territory government as we move through every community, as we have done in other states and territories, to improve the vaccination rates with Indigenous Australians as best as we possibly can. We have teams doing that. But the good news is we're pushing on 70% vaccination for Indigenous communities now. And I know that compares extremely well with other nations and their Indigenous peoples. So I want to thank all the Indigenous leaders. I want to thank our medical teams. I want to thank those on the ground. I mean, in many cases, this is a door-to-door activity, and that's exactly what we're doing, working together with the Northern Territory government. But thank you very much for your questions. Is there anything else you wanted to add, Pete, before we...
Unless there are any questions.
Premier, can we just talk about the positive case, if that's okay?
Yeah, of course.
Just in terms of, I know there was some wastewater positive testing in Norwood, and you don't know of the case there. What should people be doing in terms of getting tested in that area?
In terms of the positive test in terms of the wastewater treatment plant servicing Norwood, if anybody's experiencing symptoms, even light symptoms, please go and get a test. We don't have any public health advice in terms of a positive case in the area, so if you do have symptoms, please go and get a test.
And you're confident there's no broader risk to the community given this positive COVID case has travelled to multiple locations in the Launceston area?
Well, I think once people view the exposure sites, they'll see that the person only spent a short period of time at the different exposure sites. We're working through that and contact tracing now. As I've said, my advice first thing this morning was that there were only 19 close contacts initially, but we'll work through that, and I would expect Public Health would update that when they have further advice.
Patrons of the JJ's Bakery Cafe are going to be getting close contacts. How many people are you expecting will be isolated from there?
Well, again, that's a matter for Public Health to work through. It was only a short window of time, but Public Health will work through that process, and they'll obviously contact those people and appropriately advise them in terms of what action they should take.
And this man obviously got a test once he was notified from Public Health about being in that high-risk area of New South Wales. Should he have got a test anyway?
Well, he was tested, I would expect, prior to coming in, coming from New South Wales. But again, we have at the moment recommendation from Public Health, a very strong recommendation, that anybody that is in the state that has travelled in that was outside of the high-risk areas that have been identified across both Victoria, New South Wales and the ACT, that if they weren't subject to a pre-departure test within the 72 hours before arriving in Tasmania, they should get a test.
So this man did take a pre-departure test?
Look, I don't have that public health advice at the moment, but we can certainly find out whether or not he did.
And just one more from Hillcrest. Families of the victims are frustrated by the lack of information provided about what actually happened that day. Can you understand their frustrations, and will they get answers?
Look, I can absolutely understand their frustrations, but there needs to be a proper investigation into this, and obviously WorkSafe is working with Tas Police, and we do need to let that take its course. And obviously, when we're in a position where we can provide answers to the families and to the broader community, we will do so.
Just one more tomorrow. So we've seen 5 cases now in 3 days since reopening. Do you have any second thoughts about reopening considering that be wasted on those?
Well, the framework that we put in place to reopen was this. Firstly, as a government, we needed to be satisfied that 100% of eligible Tasmanians for the vaccination had had the opportunity to be vaccinated. Now, we passed that threshold a number of weeks ago. Importantly, we set a target, initially to be 90% vaccinated for over 16s, and then for over 12s. As of yesterday, we hit that 90% target for the over 12s, and so we've achieved the vaccination targets that we want, and as I've said, we're one of the most vaccinated places in the country and on the planet. We have put in place the systems to manage this, and importantly, we've been upfront with the Tasmanian community. We always knew that we would see cases in the state once we reopened. That's just going to continue to happen. Importantly, Tasmanians simply need to do those things that they're asked by public health, should they be a close or casual contact, and importantly, across the state. Once again, I would say to Tasmanians, do the right thing, ensure that you have good hand hygiene, that you follow the rules in respect of social distancing, and if you're indoors, and you can't socially distance appropriately, wear a mask.
Just on the Nuyina, finally, COVID delayed its arrival originally and then delayed its celebrations and the launch today. How exciting is it that it's finally going to embark on a journey?
Well, look, I think it's fantastic that Nuyina not only could be welcomed and launched in the state, but that it will be departing as well on its first journey. This is a significant investment, in fact the largest investment that's ever been made by an Australian government into Antarctic operations, more than $500 million into the ship, a $1.9 billion program over the coming years. It's an incredibly important day for Tasmania, because what this will do is underpin the benefits of the Antarctic program, and Hobart being the gateway to the Antarctic for decades to come.